Plantar fasciitis, which classically is associated with pain in the heel or bottom of the foot, can be an extremely frustrating problem, not only because it can cause significant pain, but also because it is often slow to respond to traditional methods of care. Fortunately, when addressed properly and with the right approach, many cases of plantar fasciitis can be resolved quickly and effectively. So in this video, I want to provide a basic understanding of the anatomy and biomechanics of plantar fasciitis, including the best treatment options to get you back in action as fast as possible. Plantar fasciitis is an example of an overuse injury, which occurs slowly over time as the foot is exposed to a large number of repetitive forces. You see, the plantar fascia and muscles on the bottom of the foot must be active to support and stabilize the foot and ankle during virtually all weight-bearing activities. Over time, particularly with prolonged standing or walking in occupational settings, and certainly with athletic training, the muscles and plantar fascia can become strained and overworked. This in turn creates small-scale damage in the muscles and fascia known as microtrauma. Although only small, this tissue damage still needs to be repaired, which the body does by laying down new connective tissue, which commonly is referred to as scar tissue, to repair the damaged area. When the body is exposed to the same physical stresses day after day, the same anatomic structures experience more and more microtrauma, which in turn leads to a buildup of scar tissue in and around the area. Over time, these scar tissue adhesions will build up and begin to create problems in the muscles and fascia, including excessive tightness, weakness, hypoxia or a loss of blood flow, and biomechanical compensations such as restricted range of motion and inefficient movement patterns. Of course, as all this is going on, you are continuing to do the same activities, which places even further strain on the tissues and in turn leads to even more microtrauma. Essentially, a repetitive injury cycle is established, causing continued adhesion formation and progressive dysfunction. At this point, it is not uncommon for the muscles to give way and a more severe pain to occur. Although the pain and symptoms associated with plantar fasciitis often seem to occur out of nowhere or after an activity that you are used to doing, from the explanation of the repetitive injury cycle, you can see that in reality, the problem has actually been slowly developing over time, and the onset of symptoms are often just the straw that broke the camel's back. Unfortunately, plantar fasciitis is often slow to respond to traditional treatment approaches. The first reason for this is that many traditional treatments for plantar fasciitis focus on trying to simply increase the flexibility or strength of the foot. On their own, stretching and strengthening exercises are often limited because they fail to first address the scar tissue adhesions that have caused the tissues to become tight and weak in the first place. In most cases, it is these adhesions that are binding the tissues together and restricting normal movement. So it is not so much that stretching and strengthening exercises are bad. In fact, in many cases they are necessary. It's just that to be most effective, it is critical to first address the adhesions that are creating the problem in the first place. So the first priority is to address the adhesions in and around the plantar fascia and deeper muscles of the foot, which we do using a specialized type of soft tissue treatment known as active release techniques, or ART. To apply treatment, we first shorten the muscles or fascia and then apply a very specific pressure with our hands as we stretch the tissue. As the tissues lengthen, we can then assess the texture and tension of the tissue to determine if it is healthy or contains scar tissue. When scar tissue adhesions are felt, the amount and direction of tension can be modified to treat the problematic area. As the adhesions are cleared out, in many cases the strength and flexibility problems will also completely resolve. However, if there are still some residual weaknesses, we can add some home-based exercises to make sure the muscles can function properly and make sure they can stabilize the foot. The other critical factor in resolving plantar fasciitis is to examine the entire kinetic chain to determine if there are any additional problems that may be creating excessive strain on the foot in the first place. For example, the muscles of the shin and calf are critical with respect to foot and ankle stability, and in most cases of foot pain, we find that these muscles are also weak and fibrotic. This makes the muscles of the foot work harder to compensate. When this is the case, these issues must be identified and corrected, or once the foot is cleaned up, the problem is sure to return because the underlying source of overload has not been corrected. So for complete and long-term resolution, it is important to identify any of these biomechanical problems and make sure they are addressed.